Hello, welcome to Wellbeing. I'm Guy Murphy. Today my guest is Dr. Christine Aus, a travel medicine specialist practicing at Chromis here in Newcastle, and today we'll be talking about travel medicine. Thank you for joining me on the show today, Christine. What got you into practicing travel medicine?
Travel medicine is probably the second part of my career. I worked overseas for approximately 20 years in international public health and reproductive health. So I have postgraduate qualifications in infectious diseases, and actually I raised my family and my children in Mozambique and Zambia. So I have both professional and personal experience in living and working in less developed countries.
Right. Quite a unique perspective then.
Yeah, it gives me a good broad view. I think it's not just training, it's just a lived experience, and lived experience always has a certain power to it, doesn't it?
Absolutely, it does. How can we best prepare ourselves for international travel?
There are probably some quite boring but important answers to this. The first thing would be, in general, to give yourself enough time. Last-minute trips because it's cheap or you've got something, it can be a good go, is probably not the best way to prepare yourself. But the first thing you need to consider if you're going to perhaps less developed countries, I'm talking more about, all the less developed countries, not if you're going to London or New York. But it would be to consider, are you fully protected against the communicable diseases that we can vaccinate you for in Australia? So that means all the wonderful childhood vaccinations that are given free. There are teenage and adult boosters, and that is really, really important if you travel to a less developed country where for example, measles is extremely common internationally now. So if you or your family have not been vaccinated against measles, that could be a really big problem for you. So those are the first two big things. Take time, research the location where you're going, the countries, things like that, and then look at your own vaccination history. Almost all the vaccines now should be registered in the immunisation register, which is a great source of people to check. Oh, look, my kids didn't have chickenpox vaccine. So take the time to get those things that we think of, well, we probably don't think of them because they don't happen too often here, but are much more common in less developed countries.
So it's more the most important thing is preparation prior to travelling.
Look, I really think so. It's information is power. We can get you can find out so much about countries and the climate and the seasonal risks and what might occur at some time of year and not another. And we have a lot of reliable sources. So I'm not really referring to Facebook. I'm referring to the Australian government has a really good Smart Traveller website which is related to countries, and that will also indicate current security risks or problems. The CDC in America maybe used to have a good site. I don't know if they're still funding it. And, for example, there's a site like Travax, which we subscribe to. So that gives up-to-date information on disease outbreaks and problems that can occur. So preparation and timing and, thinking about where you're going and what you might be doing and what might occur there.
How can we reduce the risk of gastrointestinal illness while travelling?
Yeah, this, of course, is a big one. And you have to remember that we get outbreaks of gastro in Australia as well. So there are some significant diseases, gastrointestinal diseases, that you can prevent with vaccines. For example, that would be hepatitis A, typhoid, fever, and less commonly cholera. So they may be relevant to the particular trip somebody's going to be going on, or the location, or what they're doing overseas as well. The next thing would be to just think about how you are going to eat and how you're going to get hydration. So the rule is generally hot, fresh food that hasn't been sitting around. If you go to countries where dairy products are infrequently part of the diet, then it's probably not a great time to have cheese or milk. So eating local foods that people know how to cook and are prepared quickly for you, I think is one of the key things. So it's certainly not a question of avoiding all local foods, but being picky with what you choose. It's probably not a great time to eat salads. As most people know, they can be contaminated with parasites or washed in unclean water. But there's lots of great dishes you'll find around the world. Again, research and thinking about what you might eat. In regard to water, so water is tricky. We have safe water in Australia. We don't think much about it. In general, I don't recommend that you use bottled water, because bottled water, you actually don't know the source of it, and normal community water can be rebottled in many countries. You have to know that your water is safe. So boiling is one method, perfectly good, boiling, rolling boil for a while and cooling off the water. But then you can also buy in Australia larger water bottles that have in-bottle filter, and the filters can actually filter out bacteria, viruses, parasites, even heavy metal. And they're often used in Australia for camping trips, because you can use essentially any water through there, and the filter lasts for many, many, many refills. So again, it's preparation and thought about things, but a bottled water is not necessarily safe. And then you also have to consider what's going to happen to that plastic bottle when you leave it. There are often not good recycling facilities in less developed countries.
That's really interesting that you mentioned the salad, to avoid salad and to avoid bottled water, because, I've seen many times in the past people encouraging the use of bottled water overseas. But I suppose now that you mention it, boiling it is really the only surefire way that you can, ensure that you're killing off all the bacteria and that that the water that you're drinking is safe.
Yeah, boiling is a great old-fashioned solution. There are also, if you're going off the beaten track, various water sterilisation tablets and chemicals that you can use if you're going to be in a more isolated area. But the modern in-bottle filters, they're just remarkable. And they actually have upscaled this technology to use at a family or village level in developing countries to supply a lot of people with safe water. It's pretty remarkable.
Okay. Yeah. And what strategies help prevent jet lag and sleep disruption?
This is one of the things, indeed, where there's no simple solution for these problems. Jet lag is usually only a problem if you are going through maybe more than 3 to 4 time zones. So that can be often if you're travelling from Australia to Africa or to Europe, or the other way across the Pacific as well. So again, you can start with preparation, so trying to be well rested before you travel, trying to get as much sleep on the plane as possible, so having earplugs and a sleep mask and maybe a light covering, so when the plane is actually going to sleep, you may get a little bit of sleep, which will help you. The recommendation is also to avoid alcohol or reduce the amount of alcohol you take on flights, because that can just mess with your system even more than you want to. And so when you get to the destination, the recommendation is to, depending on what time of the day it is, but if it's daytime, to stay up, to get light in your eyes, to get out and a bit of exercise and move around, and then try to eat a light meal and sleep at a normal time. So go to bed early, but don't try and keep yourself awake for a while. The rule is about jet lag is that every hour of time change probably takes about a day to recover from, and there really is no particular medication that can help, or can eliminate the problems, I should say. Sometimes you can discuss it with your doctor that there might be prescription medication that can help you sleep when you want to, but that would really depend on the person's own health profile. But yeah, no alcohol while you travel, try to get some sleep, get out and move around, and possibly, if you can, just allocate enough time on arrival to maybe not having the most important things that you want to do on the trip in the first few days at least, to give your brain time to settle down.
And what about the use of melatonin and things like that in combating jet lag? Does that work?
To help sleep? Yeah, there's some evidence that helps some people. It's not a universal panacea, but that would be useful as an addition to the behavioural strategies that we've talked about. So staying up, getting fresh air and exercise, light meals, no alcohol, and yes, indeed, taking a dose of melatonin before your planned sleep. Try and sleep in a very dark room. Try and sleep in a room that's not too warm, because your body wants a cooler environment to get into a deeper zone of sleep. And sleep masks and earplugs are really good, especially if you're going to noisy European cities. You might find you get disturbed sleep anyway.
You're listening to Wellbeing. My guest today is travel medicine specialist Dr. Christine Aus. How should people manage chronic conditions while abroad?
Well, I guess that comes back to that rather boring thing about preparation and time. So that would be probably 1 to 2 months before your planned trip, have a sit down with your general practitioner who knows your condition. You might need to arrange extra medication. You have to ensure that your travel insurer knows about your health issues, so that if you require help even for a different problem overseas, they're aware of some of your other issues. There's quite a lot of information for common problems like insulin-dependent diabetes. So there are websites that talk about allowing you to time your insulin injections according to the travel time, which there are little calculators that will do that for you. So I think it's that, thinking about it, information. I always recommend travellers take a printout with them of their current health problems and any medication, and leave your medication in its original packaging, because when you go through customs, you can demonstrate to those people somewhere or across the world there that actually the medication is prescribed for you. If you need to have extra medication, then your doctor can dispense that for you. You can get it from the pharmacy if you're away for a longer period of time. But again, having written information about that is really important.
And what can we do to reduce travel-related stress and anxiety?
Oh, you'll think I'm just singing the one song here. It's preparation. I think planning and preparation is the key to it all. Yep. And perhaps being a little bit conservative about what you plan to do in terms of how many museums you want to see, or how many temples you're going to visit in India. So have a good think about how you function in your own home environment. can you be out from dawn to dusk and then go on and have a big meal? Or are you somebody that might need to have an afternoon nap or just rest quietly? So I think it's really sitting down maybe with your family and say, so how would I manage that? In terms of just being overstressed. I mean, you want to see everything when you're overseas, but often it's better for you and you have a better experience if you limit what you try to see, and then you can spend some time visiting the Louvre when it's not so busy, not trying to rush around for many places. So I think that's what I would advise people. And personally, I know myself that one activity in the morning plus a nice lunch and then maybe some gentle exercise in the afternoon is probably the way that you stay comfortable when you travel. You can get easily overwhelmed.
I guess if you want to make it a holiday and you want it to be a relaxing time, it is really important to not overload yourself and to prepare well. So yeah, that makes sense.
I think it's important not to try and do too much in every location that you're going to visit. What's the most important thing? And then you'll find little incidental things. For example, if you're traveling in European cities, then often it's just walking around the old centre and seeing different things. That's the things that you remember later on, rather than a big trip to a big museum or some sort of site.
Yeah. And moving on, how can we maintain good mental health during long trips or extended stays overseas?
I guess this really depends if are they going to be working stays, or you are doing that big trip for 6 months around the world, something like that. So it's probably similar to the previous question you asked me, Guy. I think it's planning some downtime in those sort of stays. So not bouncing every few days from location to location. If you can find somewhere where you might even stay a week or so, you can relax, you can check on things, you can check in on your own mental health. I would also say try and keep in contact with your family and friends at home. We can do that pretty easily with, Zoom calls and FaceTime and stuff. So you can, so that they can get a feeling of how you're travelling in terms of your mental health, and they can give you some good feedback. I mean, if you're travelling with family, they will probably let you know, but if you might be a solo traveller, I think you can get a bit isolated. So I think that would be a useful suggestion.
Again, preparation and just looking after yourself, not overloading yourself, not overdoing it, staying in close touch with your loved ones.
Yeah, make sure that if you have medication that you need to take regularly, make sure that you have enough for the extended trip and that you're not going to suddenly run out because you may not be able to find it where you are. I think that's important.
Fantastic. And are there any specific wellbeing strategies for travellers going to high-risk or high-pressure environments?
I think if environments are high-risk or high-stress, I wouldn't recommend general travellers to go to them. I think if you need to go there for work or for some other sort of thing, for example, to see family that live there, then that's a different thing. But I think there's a lot of the world you can see without travelling to South Sudan or venturing into Gaza or the other places that can be very, very dangerous for people. Your Australian passport doesn't protect you everywhere. And again, I think it's maybe to be a bit realistic about what you want from your travel.
And how can we safely adapt to extreme climates like extreme heat, humidity, altitude, and cold?
Okay, so there are some specific strategies, of course, for some things. For example, altitude, you can adapt to it by acclimatization, so a slow ascent to a higher altitude. There's also medication that you can take in preparation if, for example, it's very common travellers fly into Cusco from sea level, so that's a big jump. So there is medication that helps you adapt. Being aware of how you would feel at altitude, because it's a little surprising if you've never been at altitude in terms of your exercise capacity and your sleep and things like that. All those things would need appropriate clothing. So think about that before you travel. Cold requires layering. Altitude may be cold, but maybe not so cold. Heat and humidity are a little tricky, but indeed, if you look at people, for example, who live in hot countries as their culture, they usually actually cover up and protect themselves from the sun. I think in terms of your activity as well, you need to be a little bit cautious about how all those things affect you. Heat, especially heat and humidity, you may well find that it will exhaust you very quickly, and that's that whole story about preparation, not doing too much, not planning too much until you actually can assess how you do feel in that environment. Hydration, of course, is important through all those areas. You can get dehydrated at altitude because you breathe faster and you're blowing off water vapor. So hydration would be key for all of them. And planning again, those are annoying things I talk about. Planning, preparation, anticipation, information.
Yeah, okay. I mean, it seems like there's the biggest thing you can do is prepare, and it seems like it's more so about what you do before you leave than what you do in your destination.
Absolutely, that's 100% true. And sometime planning, looking at the environment, maybe speaking to people, and it's depending what you're going to do, of course. Standard tourist trip, or are you doing a big hike? Are you going to do the Annapurna Loop in Nepal? All those things, yes, planning, preparation, anticipation, and don't take any of these foreign environments for granted. Don't think, for example, Australians travel frequently to Bali. Bali is not surface paradise. Bali is a place with lots of dengue fever, lots of rabies, so you could get quite sick in Bali. So just because people go to places, there are risks that you'll be exposed to that you're not exposed to in Australia. Yes.
And what are practical ways to maintain balanced nutrition when travelling?
If you're just an average person who doesn't have any nutritional issues, then I think the stuff that we talked about previously in terms of eating hot, fresh food and being sensible with like alcohol and those sorts of things. If you have gastrointestinal issues, then you should be a little bit more careful or cautious about the sorts of food that you eat. I mean, yeah, I think that's a pretty broad question, but
Yeah. Well, I mean, we have already covered that to a degree as well. I mean, the things like avoiding the salads, boiling the water, that sort of thing. So
yeah, I mean, small children and babies are a special category. When travelling, if you're travelling with little babies and small children who maybe don't eat standard sorts of food. So I do, and there are, I believe, there are websites that families can look at for that. So, for example, if a baby is still being breastfed, then that's a really good thing to continue during travel, because that is safe and fresh and sterile and everything else and on demand. If a baby is still on bottles, then you just have to think about taking your own formula, how you're going to heat it up, how you're going to sterilise it, how you're going to store it. So again, it's thinking about what that person might need when they're travelling. I have colleagues with families who are severely gluten sensitive. So some parts of the world that's really easy if they're a rice-based culture. But again, that's anticipation and planning about what the needs of those individuals might be.
Right, okay. How can we stay properly hydrated in hot or high altitude destinations? Does it just come down to proactively and preemptively boiling water and bottling it up and taking it with you, or is there other things that we can do?
I think it would be monitoring your intake. So, having a safe water supply, but just think, okay, so this bottle takes 1.5 litres. I should get through that through most of the day. And remember, there are other safe sources of fluid. So, black tea is going to be sterile. Coffee is okay as well. It's going to be cooked. But I think just keeping a track of your intake, because then you'll know if your sort of water budget is the same. And also check how frequently you pee, because if you're not peeing frequently, that means that you're dehydrated. So that's no good. So monitoring intake and excretion.
And when you say, you mentioned black tea and coffee, is this, when you mention those things, are you referring to people preparing those themselves, or buying them from, getting them bottled, or buying them from a cafe or whatever it may be?
It would be having a local tea indeed, because tea is made with boiling water. As long as you're not adding, even when you add milk to it, it's probably not going to make you sick. So that would be a safe source of fluid in a hot country, for example. If you've got fruit that you can peel and that's juicy, that's a source of fruit as well. So you can have mangoes and you can have melons. You can peel them, and the inside is clean. So, but I think it's just seeing, if you think, okay, I haven't gone to the bathroom since breakfast, and now it's 3:00 in the afternoon. Also, the colour of the urine is important. It should be nice and light. So, monitoring, and also for children, if you're travelling with children, and then you can just keep a thought about how often they're needing to go to the bathroom as well. And then you'll know if they're getting enough fluids. So small amounts frequently, but monitor the intake and monitor how they're excreting as well.
What general symptoms should we look out for when returning home, and what symptoms should prompt medical review?
Probably the number one would be fever that's unexpected,
okay.
High fever. For example, fever is the first symptom from dengue fever, and dengue is a very common problem that Australians contract in Southeast Asia. It's the number one, way above malaria, for example. Fever, headache, unusual rash that occurs close to returning home. If you have gut problems that are not settling down, I'd be concerned about blood in the stool and things like that, blood in the urine. Those things would all warrant a check-in with your doctor. And also to tell your doctor that you've been travelling, you have to tell them, I've got this fever and I was in Bali last week, or I'm having really painful stools and I was in Cambodia last week. So you have to tell them. They may not ask you if you don't volunteer the information that you've travelled recently.
How can we support our recovery and well-being after long-haul travel?
I guess that's a bit like the stuff we talked to about avoiding jet lag, isn't it? So, long-haul travel has its own issues. If you have stops along the way, then try and exercise, try and hydrate, get that sleep mask on and the earphones in when the plane is in the air. Avoid alcohol, eat light meals. I think those are the suggestions.
Fantastic. Well, it's been really interesting to chat with you, Dr. Oz, and thank you very much for joining me on the show today.
Oh, you're very welcome, Guy. It's wonderful to speak with travellers and give them suggestions on things that they might not have thought about. Actually, I have one really nice piece of information. With all the respiratory viruses that are occurring now, people are concerned about the air supply in the plane when they're travelling. But actually, once the plane is flying, that air that's coming through those cold vents is actually sterile. But the risk of viruses, airborne viruses, could be either from your neighbouring passenger who might be coughing on you, but also the air bridge when you're getting on and off the plane, because there's no ventilation. And ventilation is key to reducing the risk of airborne viruses. So I tell my travellers, grab your mask when you're getting on and off the plane, because that's a risky time.
Interesting. So it's almost more important to wear your mask through that, what was through the bridge, the air bridge?
The air bridge, yeah, when you're loading and unloading, because you're all crushed together. People either want to get on and get their seat or get off, put their luggage in, take it out. So you're all close together. So I would advise also, let all the other people go first. But yes, use your mask there. I recommend taking them overseas all the time, actually, both for pollution and for circulating viruses. A lot of less developed countries have terrible air pollution, especially at different times of year, and you'll want to protect yourself from that.
Fantastic. Yeah, that's really interesting. Well, thank you for finishing up with that. I feel like that's quite a common misconception. So I'm really glad that you thought of that and to dispel that myth.
Yeah, no, you're welcome. As I said, I enjoy very much speaking to travellers, and one or two hints can also help them travel. Eye drops is the other thing. Take some hydrating eye drops when you travel to places. You'll really get benefit from that as well.
Some hydrating eye drops.
Yeah, just simple ones, because air travel, that air is dry, and with air pollution and dust, you'll find your eyes often get sore. So if you have it on hand, you don't have to hunt it from a pharmacy.
Right. Okay. Well, there you go. And is there, while we're on the topic of these things that we haven't covered, is there anything else that you think might be relevant, or any other common misconceptions that we should know about?
I think sometimes people find that travel insurance is too expensive, and I really feel strongly it's never too expensive. It's just you can't really travel. Things overseas are extraordinarily expensive and very dangerous if you can't get good care. And I guess the other thing would be think about adventure activities overseas, if this is the time to bungee jump for the first time or ride a motorbike in places, because those are high-risk activities as well. And again, it's information and stuff like that.
Yeah, just being informed and prepared and that sort of thing.
Yeah.
Well, thank you very much again, Dr. Oz, for coming on the show. It's been really great to chat with you. It's been very interesting.
Okay, I'm very, very grateful for the opportunity. Thank you. Thank you, Guy.
My guest today was Dr. Christine Aus. Thank you again for joining us on the show. Thank you for listening. I'm Guy Murphy, and all of us at Wellbeing wish you well.